Good evening, everyone, and a very warm welcome to the 2174th day of the uninterrupted daily webinar of the International Forum for Promoting Homeopathy. It is indeed a privilege and a pleasure to welcome all of you to yet another evening dedicated to learning, sharing, and strengthening our understanding of the wonderful science of homeopathy. I'm Arya. I'm a third year student from Madhurashramam NSS Homeopathic Medical College, Kottayam, and I'll be your host today. Today, we are especially honored to have with us an accomplished academician, clinician, teacher, and passionate exponent of homeopathy, Dr. M. Krishna Manasa. Dr. Krishna Manasa is a BHMS and MD scholar with additional qualifications in CCPH and SCPH in predictive homeopathy from Mumbai. She is currently serving as the head of the Department of Organon of Medicine at Ella Shah Homeopathic Medical College, Rajkot, where she continues to inspire students through her academic expertise and clinical insight. She is also the founder and consultant of Dr. Krishna Manasa Homeopathic Clinic, Rajkot, bringing together the principles of homeopathic philosophy with the realities of everyday clinical practice. And what makes today's session particularly meaningful is the topic chosen for this evening, from aphorism to prescription, applying the Organon in everyday clinical practice. As we all know, the Organon is not merely a book of principles to be memorized for examinations, it's the basic philosophical and practical foundation that guides the homeopathic physician from understanding the patient as an individual to observing the totality of symptoms, selecting the appropriate remedy, and prescribing the prescription. So, the true beauty of homeopathy lies in transforming its principles into meaningful clinical decisions. And today's session promises to take us precisely through that journey from the words of the aphorisms to their applications at the bedside. We welcome you, ma'am. The dais is all yours.
Thank you, Arya, for such a warm welcome. Am I audible properly?
Yes, ma'am.
Thank you, Dr. Danesh. Thank you, IFPH. I'm extremely thankful for this opportunity. And my sound is properly audible, right?
Yes, yes.
Okay. So today's topic, I'm not, as I heard the Hindi session as well. So I was very fascinated that what I'm going to teach in Organon to prescription, that relation, it's already lot of things are being told in the same in the Hindi session as well. And I actually enjoyed that session as well. So let's start with today's session. I'll share my slides.
Resume slide.
Okay. So as you say that as just Organon, we say that like little bit turbulence is there always in the beginning of the disease. So similarly, I had this little bit turbulence. So aphorism to prescription. This is today's topic: applying the Organon of medicine in everyday clinical practice. Actually, this topic is very much useful because the thing is that I usually get this doubt that students are asking me that Organon is very boring, because being an academician as well, I always hear from students that Organon is very boring. You can see my video, right?
Video is not open now. It's only audio. Now it's fine. Now video also.
And they usually say that yes, sir, yes, sir. So they usually say that why homeopathy is so slow, or why we have to take such a long case. And usually in the beginning of the practice, many of the practitioners have this confusion that which case we have to refer to the other system of medicine, which case we can tackle, and this case can we tackle, or this case should we go in the same way constitutional Dena sector we should give, what we have to prescribe. So this kind of confusion keeps on happening. And there are so many schools of homeopathy as well. Some are sensation method, some is predictive method, some is HHF, some is this. Like every physician, those who are practicing good, they at the end reach into a way, and then the tools which they are using, they are teaching other students, other practitioners as well. This is very good actually, but there is a confusion. It creates confusion in the beginner's mind, in the student's mind as well. So I would like to take them back to the aphorisms. First of all, learn the aphorisms, learn what Dr. Hahnemann has told. Then you decide whatever you want to decide. So this topic is very vast in itself, but I would like to go through one case, and in that case, which aphorism speaks what and how we have to manage. This is how I would like to go ahead. So a beginner in homeopathic practice is getting exposed to different schools. So this is like just a reference back to your source. So the real challenge is not knowing what is the aphorisms, memorizing it, or just passing the BHMS or MD, but it is applying it, and it is actually very useful also. So at the end of this case, at the end of this whole session, we will see that how to understand an approach of prescribing as per every case, whatever the case comes, and how we are going to approach for that. Differentiate between various disease symptoms, the characteristic symptoms, what is disposition, what is constitution. These are the various words which we are listening, and that we will refer back to the aphorisms and recognize what is the practical role of various aphorisms which we are reading, memorizing, understanding in the theory, and understanding susceptibility and repetition, which is a very major factor in case of prescription, which in which lot of beginners and a lot of practitioners get arrested in that particular problem. Apply Organon principles to follow up rather than prescribing mechanically. That this particular physician has given this prescription, or this case has well cured results in this particular pattern. Like that, we should not copy. We can learn and develop our own skills, but we should not copy. We should have a source. We should go back to our source, and that is why this particular topic I was like interested to take. So today's case was of a male, 55 years old, who is in Rajkot itself. He's working as an iron machinery shop. Through this case, we will go ahead through aphorisms. This case is a case of patient who was having itching in the palms and in the soles, and there is a blackish discoloration over the limbs as well. This itching has started since 3 years, and it has increased since 1 year. Why this is happening? Because he is a machinery worker, and since 3 years he has been observing that initially whenever he is working in the factory and using this oil paint and turpentine oil for doing the varnish, he is getting slight itching. This happened only since 3 years. However, he is a mechanic he is a iron machinery person working in this iron thing from quite a long years. But since 3 years, he started with this complaint. And initially it was little bit of itching in the hands and the fingers, and then gradually it has increased, and now this has become very rampant. The increase in the symptoms also followed by taking allopathic medications. So because of which little bit amelioration, like again there will be increase in the symptoms. So allopathic medicines he has taken on and off for 3 years with temporary improvement, and followed by again aggravation. And this since 1 month it has increased a lot. And since 2 weeks he is having a lot of even physical generals are getting affected. So where and all we can see this particular problem. It is in the palms and in the soles, itching, dryness, thickening, blackish discoloration. There is even cracks and cracks, feeling with discoloration and thickening. In the bilateral lugs, in the anterior side, there is blackish discoloration and mild thickening. All the complaints started gradually and progressed gradually. All the complaints, the itching, especially the itching and the dryness, is worse in winter, and it is mainly triggered because of the turpentine exposure. It is increased, and because of the heat of the welding machine also it has increased. So with past this 1 month, we can see that he has, because he's already taking allopathic medication, there is no relief. Then he stopped taking the medication itself. When he has come to me, the patient, when he has come to me, he was not taking any medication from past around 6 months. He is just using oil and just bearing that complaint. So when he came to me, he was in a state of extreme sadness. He was very despaired. When he came to me and when he sat in front of me, he was like, what I should tell? I'm in Hindi, he was saying, what I should tell? I'm extremely sad. I'm extremely fed up with these complaints. How much ever I'm using the medications, how much ever I'm expending the money, still I'm getting again these complaints back. Now I feel like this is never going to get better. I'm having burning. I don't feel like eating, seeing my hands. I don't feel like working, seeing my legs. So he was very gloomy and sitting like this and telling, and full this actions were there of sadness, of full melancholy, that there was a state in him that he was trasta gaya. He was very completely up thak gaya hai, okay, he's tired and in despair. So this state I had taken because in genuine I know the person, I had seen his wife, and he has come to with the wife as a bystander. And I've seen him. He was a very general, nice person, very not jovial as such, but cheerful and calm person. In this such way, despair was different. It's a different state for him. So I've taken it as a concomitant. And I asked his wife also that is it happening regular, this state of this day only when the complaints are there. It was not before then. So I have taken this particular symptoms during the case taking. So if we see for the, of course, those who are already practicing, you know that this is the skill in case taking. For the beginners, I would like to just focus, because they are students and PGs and beginners as well. So I would like to focus. This is how sometimes the patient presents itself. Nobody will say that I am in extreme sadness, I am extreme hurt. The facial expressions reveals itself. And I just sat and I told, what is the problem? That was the only statement I said. And he said so many things about his complaints. Then I just told, okay, are you feeling different, something emotionally? Because I could see in your face. I just told this line, and then he suddenly blubbered all those stuffs. So there is a way Dr. Hahnemann says that we need to keep quiet, we need to listen, we need to observe when the patient is talking. Many times, just that is enough for the person to say, and it gives an open space for the person to say as well. Now, if we shift on to the physical generals of this case, he was having decreased appetite. I'm not going in detail because there is a lot more to discuss. I'm just telling you the fast, okay? Appetite is reduced, sleep is disturbed since past 2 weeks, and there is the patient is thermally chilly, thirstless, craving for sweets, and he is having aggravation from milk. Whenever he drinks milk, he gets a mild loose stools. Okay, and there is a profuse perspiration all over the body. No foul smelling perspiration. Bubble and bladder habits are normal. So patient is thermally chilly and profuse perspiration. Milk causes diarrhea. I am sure many of the practitioners know what I am giving. I agree. What I am giving is many of the practitioners will definitely know that. Along with the already I told many of the concomitant symptoms also. I would just continue with the mental generals. He was extremely sad about the skin complaint. His eyes were wet when he was speaking. That was an observation. He was despair, hopelessness. Despite repeated medicines, patient was not better. Appetite is reduced, sleep is disturbed about thinking about the complaints. So for him, those complaints were extremely hurtful because it is affecting his emotional state also, which is affecting the physical state. Anxiety about business, workload, and financial security, suppressed disagreement to maintain family or business harmony, religious, compassionate, helpful, family oriented, difficulty in making decisions independently. So here you might think that I am just telling all the rubrics or all the materia medica mind symptoms in the case, because actually I just want to go fast forward in this case. I want to focus that if it is not a major it's not a very great disease or a very major disease that nobody can treat and we have treated. I don't want to showcase such a thing. I want to showcase those simple cases which come to our clinic, which is our bread and butter, which is not getting better in allopathy or modern medicine, and how we are going to approach to those cases. If we know the approach, if we know the roadmap, if we know what is the steps to follow, this, there are so many variations anyhow in homeopathy. At least something should be stable, right? And that stability I want to bring through aphorisms. So that's one stability is how to approach to a case. You have completed the case taking. I'm not focusing on case taking in this particular because the time is a limitation. There are many other components which we have to revisit. So how to approach a case? Suppose you have taken a very good case, you have completed from 83 to 100 aphorisms. अच्छे से you have taken the case. Now, how will you approach? Is it acute case or a chronic case? Tell me. Because if you can just suggest something, please. It would be fun if we had in practice session. I can't hear Dr. Arnab. You have to speak, unmute and speak. I'm very glad that someone is speaking actually. So is it a acute or a chronic? Okay, I think you cannot unmute maybe. You're driving, okay, just focus. Anyone else? Acute or chronic? Is it a local skin disease or is it a dynamic? Is a local, like I want to say is that it's a dynamic disease or it is a pseudochronic disease? Anything you can suggest? And do we need so many mental symptoms? The characteristic symptoms were good enough. Do we need the characteristic symptoms? And do you think the application of that particular ointments on the hands would have altered the case? Anyone would like to text? So I would go forward. In each case, we work for as an outline. What is the disease that has to be cured? Which comes from aphorism 3, that is the knowledge of the disease. Then we go to the answer to this understanding that the complete case is taken. Now this case will fall under which disease? Knowledge of disease, how will we understand the knowledge of disease? Only through case taking. Once the case taking is done, only then we will be able to understand that whatever symptoms we have taken, okay, these are the symptoms we actually have taken. Now this case will, how to manage this case? You have a case, you have the patient, you have the disease, you have the reports, everything is done. Now how to go forward? Here, Dr. Hahnemann very beautifully, I extremely am astonished at his wisdom, at his intuition, that how well he has covered every aspect which can come as a patient. That is the classification of disease. I think my slideshow is again stopped. So if we see in the classification of the disease, can you just suggest under which classification of disease this particular case which I told that will come under? Anything? Anyone would like to? I cannot see the chat. Pseudochronic case. Okay, Radhika. Acute dynamic. Okay, Priyanshi. I hope anyone else would like to say? Yeah, my slide is not moving. It will stuck. Yeah. So chronic, it is a chronic disease. It is not an acute disease because why? Why, Priyanshi? I'm really happy that you answered. We have to make an assumption always. We should never be afraid of making an assumption because this is the learnings. So it is a chronic disease, not an acute disease, because the patient is having it from 3 years and it is a constantly present. On and off, it is coming and going, but it is constantly present. This particular diagnosis of occupational dermatitis, it is having this phenomenon in disease itself that it can come and go. So this is a chronic disease. It is not an acute disease. So this is where we have to see. The timeline is not the only factor which helps us in classification of the disease. Whether it is acute or chronic, it's not only the timeline. It depends upon rapid onset, sudden progression, and also there is a explosion of the latent sora. Because explosion is there means there should be some exciting factor. So then it will be called as a acute disease. And the exciting factor, if you are thinking that it can be the turpentine oil exposure, it cannot be, because the exciting factor is something which is actually causing the susceptibility to break open in acute disease. Okay, and there is a latent miasm in the background, and there is a change of phase from chronic to acute because of the latent explosion of the sora. Sorry, explosion of the latent sora. I'm sorry for that words. So this is chronic disease, which is a, and is it a pseudochronic disease? As it has been told by some of the students, it is not a pseudochronic disease. Why? You can say, you can disagree. It is a pseudochronic disease. आप ऐसे ठोक के बोल सकते हैं नहीं है. It's okay. Actually, this is not a pseudochronic disease because what is a pseudochronic disease? It is a inappropriately named. If we have to know something that it is not that, we should know what it is, right? Then we will be able to differentiate. Inappropriately named chronic disease. They are self-inflicted states of ill health caused by continuous exposure to avoidable noxious influence rather than a true chronic miasm. It is a state. It is a state which is created because of continuous exposure to avoidable noxious influences. Avoidable noxious influences, my examples are also given. I would like, my arrow mark is seen. Mouse ka cursor, is it visible? Okay. Not sure. So in the according to aphorism 77, what is the factor which is called as obnoxious, avoidable noxious influences? This dissipation of that undermine health, undergoing prolonged abstinence from necessities required to support life, residing in unhealthy or marshy localities, living in confined dwellings or cellars. Let's break it down to present generation, with not the one which was there during Hahnemann. So today we are not exercising, and then we are getting into a state of increased in insulin levels. Not there is not a complete transformation. There is a state wherein the patient can go back to normal if he is exercising and if his diet is doing proper. It doesn't mean that there is a increase in HbA1c or there is a increase, like there is a slight increase in the blood sugar levels only temporarily, or otherwise temporarily increase in the blood pressure, which when if the stress is not taken, if the lifestyle is maintained, it goes back to the normal. Or if there is a case where the patient is having headache because of continuously looking into the laptop and working, and then when he starts doing eye exercises or not doing such things, it goes back to the normal. Or is there is a state where like my maid, she was working in the kitchen and for a long time every household she goes and she works, so she gets that skin gets erupted, and then there is a slight itching, which is better once she started wearing those that wet shoes, or when she stops that. So these are all pseudo chronic diseases. Okay, that is what he's telling. Unhealthy living, unhealthy areas living, unhygienic livings, because of which lacking fresh air or physical exercise, ruining health via overexertion of mind or body. So when this overexertion of mind or body is stopped, then there will not be any case of pseudo, then there will not be called as pseudo, then there will be returned back to the normal state of health. This is what is pseudochronic disease. But is this aphorism suitable in our case? If we stop using the turpentine oil, will we reverse the disease? What do you say? No. Yes, we will not reverse the disease if we stop using the turpentine oil, because if it would have been the case, then it would have been better long time before. So this is not a pseudochronic disease. This is a disease of true chronic miasmatic disease. And it is happening, the allergic products, he was exposed from long time as well, but since 3 years only the symptoms have started. So since 3 years something happened which triggered the susceptibility, and then which triggered the symptoms to happen. Here I would like to bring attention to the obstacles to cure. Here the obstacles to cure, aphorism 208, 252, 260. The recovery is not happening then and there, must be some obstacles to cure. Okay, so here the turpentine oil is an obstacle to cure, and the disease is a true chronic miasmatic disease. Now once we are clear with these two things, it is not a pseudochronic disease. If we are removing that, then it will not become better. Then now we have to approach as a miasmatic disease. So now we will use Dr. Hahnemann's idea of how to approach to a miasmatic disease. Under that, fully developed, there are a lot of symptoms. So how will we approach? This is how we have to think. This is how I would like to say that every case, whichever case comes to us, after taking up the case, we need to stop and we need to think that this type of disease will come under which classification of disease, and what Dr. Hahnemann told its management. Is it an indisposition? Is it acute disease? Is it a chronic disease? Is it a surgical disease? What is the condition that we need to we have approached the case with, and then how to manage it. So our management does not depend upon our only one type of prescription, that is constitutional prescription. It does not depend only on one particular thing. It depends upon what the patient is having and what the patient is coming with. So our most of the time what happens is that we are thinking on the line of what we know, not how the patient is coming to us. In our clinical practice, this is what is happening. I would like to show some of the obstacles to cure the slides. This all you know, and this all you know, time is a constraint. This is on directly from the Organon I have put, like removal of the room from strong smelling flowers, hysterical suffering, removing the foreign bodies, and these all we already know. What we are missing usually from the Organon is the footnote. Usually when we read, we learn, we don't apply the footnote, we don't memorize the footnote. But in the footnote, lot of great questions are given, lot of great aspects are given, that where we have to focus. So I would bring back the attention for the practitioners, and for beginners I would like to draw your attention that read those footnotes as well. So in aphorism 260, objects of anger, grief or vexation, mental or bodily overexertion, avoidance of any emotional shock, and other medicines. So there is obstacles to cure. Dr. Hahnemann mentions that it is lot of things can become an obstacle to cure. What does it mean that lot of things can become an obstacle to cure? It means that whenever a case is coming to us, we are prescribing as per the true chronic miasmatic disease. You have taken the totality, you have given a prescription which is including miasm and including the characteristic symptoms. Completely everything is perfect. But then sometimes there is a, partial improvement, or sometimes there is a mild improvement, sometimes there is no improvement, or sometimes there is an improvement and then there is a stagnancy. Here we have to think that if our prescription is right, then why there is stagnancy? If our prescription is right, then why the results are not coming up to the mark which it should have come? So there is one reason, it could be the obstacles to cure. That in the footnote, Dr. Hahnemann gives a vast reasons, and I would like to just gist. Some of it is diet, some of it is emotions and mental, and some of it is the herbs and medicines. So there should not be intake of any medicines, that we all knew. But some things which we miss is the increased amount of food which we are usually taking. Different kinds of foods like Chinese and other herbs tea, beer prepared with medicinal substances, liquors, like all the addictions are happening in the patient. Then there is no removal of the addictions. There is no removal of eating highly spicy food, sauces, spiced cakes, ices. There is all those diets we are the patient is following, not following. The patient is having his lifestyle, sedentary lifestyle. He's having outside food. He's not sleeping in time. He's getting up and he's not exercising at all. He's sitting in the chair and doing full day work. He's taking a lot of emotional stress and overthinkings. So that all becomes a obstacles to cure. And here I would like to express my opinion as a clinically what I have seen, that even the cases where there is a very good results, it has stopped, and it has again the complaints are reverted back, even though if not in intensity, but still little reverted back. And it happened because the patient has went into again some kind of emotional stress or some kind of major physical stress. In that case also there is again reversal back of the symptoms, and that is what is obstacles to cure. So whenever, suppose if you are prescribing a case and there is a relapse of the complaints, a patient has improved but then again there is a relapse of the complaints, it is very important and essential to inquire that was there any kind of emotional stress which has triggered or which has happened in between those days. If that has happened, and if the patient you feel that can able to handle it, then it is well and good, and you need to give some advices for it and then let it go if there is a catharsis and the patient is relieved. If not, then we need to repeat the prescription. That is what I have seen and I have learned from the seniors. Okay, so uncleanliness, unnatural debauchery, innervation by reading obscene books, reading while lying down, onanism. So there are so many things which can cause this kind of symptoms. Subjects of anger, grief, vexation, passion of play, overexertion of mind or body, especially after the meals. So after eating also, if we are finding out. So now how am I working out in this case? It is a true chronic disease, and we have seen there is obstacles to cure which has to be removed. So here in this case, I have to remove the exposure to the turpentine oil, and then only then it can be working out, right? So I have first of all, we have to understand that which miasm the patient is in, because it is a miasmatic case. Only then we will be able to lead on. Okay, which miasm we have to more focus on, what type of medicine we have to choose which is having that predominant miasm, and then we have to proceed. So I have divided those symptoms into SORA, psychosis, and syphilis. The patient is dispositionally timid, cannot take decisions, affectionate, sympathetic, hardworking, anxiety about his health, craving for sweets, perspiration profuse, more on the head, aggravation from milk, and itching, dryness is all in soric. Now, what is this timid cannot take decisions, affectionate, sympathetic, hardworking? These are all his basic nature, right? This is not the nature which he has got from the disease, right? Everyone agrees to it, right? So, can you tell me what does it mean? Has been a So, can you tell me what does it mean? Do you know that we all know this word disposition? We all know this why we have to take, but do we know that why we have to take the cases which has happened, or we have to take those symptoms in the case? Why we have to take such a long case? Why we have to take such a long mental generals? That how were you in your childhood? How was your nature? What is the need? This Dr. Hahnemann speaks in explaining the disposition. He says that disposition is altered. General nature of the patient is altered. When it is altered, whenever there is a it is altered whenever the patient is having a chronic disease or any kind of a dynamic disease. The patient's basic disposition is altered. If he is hurried, the patient can become calm. If the patient is very calm, the patient can become very angry and obstinate and very malicious. If the patient is he has given an aphorism, a footnote, an example that the patient is very mild when the patient came for the case, but after the prescription I have actually the patient was very malicious and cruel type. So there is an alteration in the state of disposition, and the characteristic symptoms of the mind are present in the disposition also. So that is what he has told in aphorism 210 to 213. And he has focused that we have to take the disposition symptoms also. So what is the disposition symptoms? These are the symptoms which the patient is having through the genetic makeup. Through what makes him an individual? What is his basic nature? That is what is the disposition. And that is what is the importance of that particular symptoms. That is why we have to take such a case wherein we are asking in childhood what was your nature, wherein we are asking if you're getting angry, what is your repeated habit of expressing, how do you express your emotions. We are trying to understand the patient's behavior, the patient's mindset, the patient's sensitivity, what is hurting the patient, and how he is expressing the hurt, that to understand the patient's basic disposition. So here, if we are to understand disposition, it means those nature, those traits of the mind, either emotions or behavior or the intellect, which is coming out of the genetic makeup of the patient, that is the disposition. And that is where we are going to get the characteristic symptoms along with the altered state. But there we have to search. That is what Dr. Hahnemann told in aphorism 210. And that is why 210 to 213. And that is why we need to ask in the mental generals, in the life space, what is your childhood, how is your family life, how is the interpersonal relationships, how is the work life. These questions are coming because we need to know the reaction pattern which the patient is having since the childhood, since the patient is developing stage until now. That will know that this is the characteristic symptoms of the mind. Okay, so in this case, despair of recovery, ailments from fear that business is not going well, religious, timidity, hardworking, and sympathetic. That is what I have taken in mental generals. It consists of both the disposition and the altered state of mind. Both of it is there in this selection of the remedy, as per Dr. Hahnemann's protocol of true chronic miasmatic disease. Which next is physical generals. Milk causes diarrhea, perspiration profuse, thermally chilly, thirsty, in the characteristic itching, dryness, cracks, and thickening of the skin with blackish discoloration. So this is what I have repertorized, and I have got as graphitis. And as a general management, to manage the obstacles to cure, to manage the maintaining cause, we have to ask to wear protective gloves while working in his factory and while using turpentine oil, frequent application of glycerine to avoid a dry skin and cracked skin, to secondary infection nahi hona chahiye. This is, I'm not telling something very great. I'm not telling something which is out of the box or something which is make very special. But I want to tell that this is how we have to manage a case. That is what Dr. Hahnemann says, that along with the uh, prescription, we need to manage the obstacles to cure as well. Otherwise, the result will be not sufficient enough. So, in suppose if it is not this case, if there is any other case of sedentary lifestyle, then we have to ask about exercise, diet, and his regimen, daily regimen. If there is any kind of disease where the patient is having a physical difficulty or deformity, then we need to advise for physiotherapy. Whatever is required, we must do as a secondary management along with the prescription and the medicine. So this was the how the patient had, and this was the first follow-up. I would like to explain that when the patient had come, he was very anxious, very despair, and he was also feeling very sad that a lot of money is getting expended. He has a lot of money problems, and how much he is hardworking, still not able to build a house. So he was constantly having this anxiety about money, and he was constantly telling that how much the wife is expending, how much the child son is expending, and still he is the only one who is saving. Still, when he came for the follow-up, what he said is that I left everything now. Let them expend if they want to expend. Let them do if they want to do. I'm okay now. Okay. And this anxiety also stopped his worry. He's not, he bought washing machine and gold earrings for wife. Yeah, that was something which was very astonishing. A one who was very much talking about that he doesn't have money. He was very avaricious. He was very anxious about money. He bought a washing machine. He bought gold earring for wives, and he's saying that he's not anxious about the money. Appetite is good. The cracks have healed. Still, we will see the follow-ups also. Here, I would like to tell a clinical thing that I have observed in multiple cases, that whenever we are prescribing on the basis of totality, including the mind symptoms, which is abnormal because it is an altered state of the human being, that even that is also coming back to normal. So whatever altered state the patient is in, if it is a mind, even if it is a chronic disease, even if it is in physical general, if it is in characteristic particular, everything will come back to its normal. So how you will know what is altered and what is not altered? And for that, we have to take the full case history. We have to take the full mentals. We have to take the full physicals, whatever the format we have, which we generally follow in all the colleges, which we learn, that we have to follow. So only then we will be able to see the difference between what was altered and what is present state. And this is what I have seen in the patient's mind. And in many of the cases, I have seen that patient is able to adjust in the surrounding situations. The patient is able to adjust. Why I have reduced it, if some seniors can help me, that which aphorism says that, I am not able to get it, that I have deduced it, that it is mainly because if there is some kind of delusion in the patient mind, or if there is some kind of a fixed notion in patient mind, or if there is an alteration in the perception regarding the surrounding situations, not able to adjust, because adjusting is a human nature, it's a human capacity. We need to adjust, and this is a learning which happens in every human being, that they adjust. But they try to accommodate themselves. Till it is hurtful, they try to accommodate themselves. If it is not happening, after giving a prescription, the patient starts to accommodate themselves, whether it be a working environment, or whether it be a family situation between the in-laws or between the husbands. the patient is able to change their perception on it and able to work out with the interpersonal relationships are improved if the remedy is right. That is what we even see in the signs of improvement. I'll go forward fastly. So this was the prescription, and 2nd February again the mental generals were calm and happy. Yes, skin has healed, the peeling of skin has present, but it is not much, and there is slight cough has started since 1 week, which I have given a Kali Sulf 6x only to soothe it, and rest is SL only. I have not repeated. uh, After that, there was a one more follow-up where I had seen that the patient complaints have recovered, had relapsed again. Slight relapse was there. The intensity was not severe. I waited with SL for some days, but it has no improvement, and and it is increased. Even patient was getting irritated, so I gave graphitis 200 once again. So my prescription was first prescription was graphitis 200, 4 pills once a week for 4 weeks. I have given. It is a psychotic, and the patient was also having occupational dermatitis. There is a maintaining cause present. Susceptibility will be moderate to low, and that is why I prefer this graphitis 200. So this is what in aphorisms, if we see aphorism 3, 5, 6, 7, 72 to 81, 84 to 90, 153, 210 to 213, and 259 to 261. All these aphorisms speaks the clinical aspects of the prescriptions. Okay? It all speaks about how to go ahead in every case. This was an occupational allergic dermatitis is the diagnosis. The occupational exposure was a maintaining factor, and the physical generals and the mental generals were used to individualize the patient. The long case which we take is not a load, it is not an extra load. It is a way that how we have to reach to the minimum to individualize the prescription. As we grow in our practice, this style of prescription or this style of extra taking long case, or some people change it, modulate it. Some take in a shorter way, some take in a long way, but the basic is we have to cover all the data which is given by Dr. Hahnemann in the aphorisms of case taking. In aphorism 210 to 211 explicitly discuss the alteration and importance of patient's mental disposition during illness and its primary role in remedy selection. Dr. Hahnemann specifies that what the patient's mind is important for selection of the remedy. That is why we need to take the disposition, how the patient's basic nature is. And in this, I would like to specify that while taking the case, anger, hurt, sad, this kind of vague emotions are not to be taken, because Dr. Hahnemann specifies that we should not take any vague emotions. Then what kind of symptoms mind we have to take? This also he has very well described. We have to take those mental emotions which we can qualify further. If it is anger, when he is getting angry, what is making him or her angry? What is triggering that anger? And what is the patient's expression? In my clinical practice, I have learned this in a vertical way. What is the need of the patient which is not getting fulfilled, that is leading into a trigger, and that trigger, how the patient is expressing, that whole thing will help us to understand the patient sensitivity, what is hurting the patient, and how the patient is reacting to it, expression of the patient. This phenomena can help us in, if you take a case like this phenomena will help us in the prescription. Aphorism 210 notes that in all corporeal diseases, the condition of the disposition and mind is always altered. Hahnemann details how a patient's disposition shifts from their healthy state, such as a mild person becoming violent, hasty, obstinate, or despair, or a clear-headed person becomes obtuse in intellect. Like in this case, we can see that the patient was originally calm and composed in nature. He's a mild person. If we see his disposition features, which I have written, it is timidity, it is sympathetic, it is compassionate, it is not an anxious person. He's a hardworking person, but not an anxious and extremely fearful. He's not that type of person. He's a religious and having a faith person, so he will not be extremely irritable, or he was very timid, affectionate, and sympathetic. But in the altered state of mind, altered state, when there was a disease happening in his body, when the miasms were overcoming the vital force, his state of mind has changed into extremely anxiety, extreme despair, and extreme sadness. This is what Dr. Hahnemann is telling, that there is a change in character. Sometimes we see that patients get confused, patients get absent minded. That is change in the intellect. Sometimes their memory gets weak. Sometimes the patient says that, as nowadays I'm not able to remember properly. Nowadays I'm not able to, I forget where I'm keeping the keys. Nowadays I don't feel like working. I don't feel like studying. I don't feel like cooking. Females in the family setup, they feel like, I don't feel like doing anything extra. Whatever is doing, that is enough. So their state of mind is changed. That is a expression of the diseased vital force. That is what Dr. Hahnemann is saying. Aphorism 211, remedy selection and characteristic symptom. The same thing which I have already told, that this disposition acts as a characteristic symptom of the mind along with the change in this disposition. Both. Okay. So aphorism 153. Now we will focus on, if there is a true chronic disease, we have to focus on the characteristic symptoms that we have already know. One of the characteristic symptoms is from the mind, and that we have already seen in disposition aphorisms. This is aphorism 89. I have given it in a tabular form, where this is a footnote of aphorism 89, where Dr. Hahnemann very well and very explicitly, in a very detailed manner, tells how to ask a question, what question to ask to reach to the disposition, to reach to the altered state, to reach to the altered state in the body, and to also understand the characteristic particulars. So if some student or if some practitioner are thinking how to get the mental symptoms from the patient, what to ask, what not to ask, they should come back and refer to this footnote once. If we see, I would like to just focus, see, the physical generals are easy to take. So that's why I'm focusing on the mental generals. The patient's state of mind, present state of mind. That is what he meant. Abhi kya, what are you feeling right now? What is the feelings of the patient right now? What has changed in the patient's disposition, behavior, or emotions? We will ask, I usually ask this question, do you feel any change in yourself since the onset of these complaints? If in Hindi, English, Telugu, Malayalam, whichever language it is, this is how I frame it. I'm telling it for the beginners. Of course, there are seniors, those who know what is it. I'm just telling it for the students as well. What are the patient's fears, anxieties, irritability, sadness, anger? So we are trying to address whatever human emotions are possible. And how is the reaction in that, how that reaction is expressed? That is what we are going to focus. What situations aggravate or ameliorate the mental state? What happens that this particular state of yours increases or decreases, or there's a change, or what triggers it? So these are the factors which help us to understand. Suppose a patient is not eating in anger. What makes you angry? What is, suppose the patient is saying that I'm angry because my friend has not spoken to me. So if the friend is not spoken to me, then, and expression is what is hurting it, I am feeling insulted, that why she did not speak to me, what is so much attitude she's showing, it is insulted. Why she doesn't talk to me, why she doesn't like me, I'm doing so much, it is love. So there is a difference that we need to understand, that what is the sensitivity that is making this patient to behave in a particular pattern. What is unusual or altered in the patient's behavior? What do relatives, attendants notice about the patient's behavior? This is also very important. The bystander, what does the bystander say about patient's behavior? But we have to judge it. We have to not completely believe it. Dr. Hahnemann also says that we should not completely believe it. We have to judge also that what the bystander is saying. Is it right or is it wrong? I have many times I see that some of the patients, those who are telling that I have problem with the boss, I have problem with the wife, I have problem with the different like my in-laws, my mother-in-law, my brother-in-law is not good, no one is good in the house. When you send the patient out and you bring a bystander and you make them sit and you express, the bystander tells a different story itself. So this is why it is very important to have a patient's bystander's information also. What does the patient himself notice and describe? Observe the patient's expressions, gestures, and manner of speaking. So this is very important, like how I am speaking now, how a patient will come and sit. All these things are extremely important, and this will be detailed in a detailed. It can be spoken in during the case taking and its format. How the patient sits, how the patient talks, how the patient comes, what is the facial reaction. As I told, in this particular case, the patient was sad, the patient was gloomy, the patient was anxious, the patient's eyes were wet. So in particular time, when the in that 40 minutes of conversation only, we need to observe the physical stature, the physical body, the expressions, the mind, everything. That is why in case taking, there are 4 points are given: fidelity in case taking, observations, and sound senses. That is why it is given. This is how we have to develop, and this is how the great physicians are already working, and this is what we have to learn from them. It is a skill. It is a skill which we have to practice.
Yes,
Okay, so now next is
only 3 minutes remaining.
yes. So I would like to just end the case in one particular thing, that whenever there is a new case approaching, after taking a case properly and evaluating the case, after proper case taking, we have to do the classification of the disease. The disease will come under which particular classification, and then go ahead with what Dr. Hahnemann has told about that particular disease. If it is a surgical disease, even then we need to work it like that. And if it is a dynamic disease, we have to work like that. If it is an indisposition, we have to work like that. And we should not forget this particular important step. Any doubts we can ask? I think I have prepared much more slides even about rest of the diseases. We can do some other time. Any doubts are there, then
Yes. Yes, Doctor, it was really an excellent session and very good utilization of organon of medicine in finding the right medicine. And that's what we got from your presentation. Since there is lack of time, otherwise we could have go for some more questions and some more discussion. If any, Dr. Manoj. Yes, yes. So Dr. Rambarasha, sir, you can say a few words. Please unmute. Yes,
Thank you, Dr. Ramesh and congratulations, Dr. KRISHNA Manasa. Very nice, excellent session. Describe the organon of medicine and philosophy, homeopathic philosophy. And, and chronic, acute and chronic. Dr. Hahnemann, organon of medicine, APHORISM 77, classification of disease. First, in this position, maintenance cause of disease, and dynamic disease, chronic disease, miasmatic disease. So, three fundamental chronic disease, Sura psychotic concept. Very good describe the and case. Very good describe the organon of
Thank you,
medicine. Very thanks. Congratulations.
thank you so much, sir. And
You are live Bombay. Bombay. You are
Yes.
live Bombay.
No, sir, Maharashtra, in Maharashtra.
Rajkot, sir, Rajkot, Gujarat.
Achha,
I'm
sir.
currently living in Rajkot, Gujarat. I'm a Telugu by language, actually.
Yes.
Chaliye.
Dr. Karnagar, you can ask the same your question.
One question is there. Should I address it, sir?
Yes, you can go ahead.
The parameter is as the signs of improvement, as per Dr. Hahnemann, and I have written that as well. It is basically, if there is improvement in the mind, if there is improvement in the nature of the person, if the patient is calm and composed, if the appetite and thirst, that physical general, that is the basic what is required for the patient in his daily life, all this coming back to the normalcy, that is a sign of improvement. And if you speak specifically about occupational dermatitis, there is no recurrence. I have been following the patient. I have told the patient it takes 1 year. I am not told it takes 6 months. Usually I take little longer time for the patient, and I tell them that it is a long treatment. I told 1 year, so the patient is still coming, and the patient is on SL, and I am monitoring the patient. There is no after the last picture which I showed, there is no recurrence, no relapse, even though he's still working in that same place. So this is what I want to say, that occupational dermatitis is such a occupational disease, is actually community health. It is very major aspect, but still, ma'am, can prolonged maintaining cause create pseudo chronic disease? Prolonged maintaining cause. First of all, pseudo chronic disease in aphorism, it is clearly written, if there is any kind of stimulant which is given and then disease is happening long time, if the patient is taking long time and then or exposed to the long area, but if we can revert back, if the patient can revert back, suppose now if I'm sitting in the bus and traveling for a long time and I'm getting backache, now if I'm doing exercise and if I'm doing a belt for some days and I'm coming back to the normal, and then I'm not having any physical or structural or any functional changes also, then it is a pseudochronic disease. It is happening because of the maintaining cause. Once the maintaining cause is removed, it will come back to the normal. This is a very important point which Dr. Hahnemann has told. If the maintaining cause is removed, it will come back to the normal.
Okay, madam. It's over to Ms. Arya to conclude the session.
Thank you, ma'am.
Thank you so much.
Please.
Thank you, Arya. Thank you, Dhanesh sir. It was extremely great being a part of your webinar series. And and all to all the seniors and to all my students who have joined, I'm extremely thankful for their cooperation and support. Thank you.
Please.
Thank you, ma'am, for
Thank you.
being with us today. It's our pleasure actually to have a session from you. I know that it could be prolonged. You have a lot to say.
The topic is very vast.
Yeah. So we know that you have a lot to share, and it takes time for such a vast topic like this. But even though we are extremely sorry that we have a fixed time limit every day, just 1 hour. So I'd like to conclude this session, and I thank all the participants who are present here. And thank you, everyone. And in case if you have missed any videos, you can check out our YouTube channel, IFPH Talks, where we will upload all the daily webinars going on. Thank you, everyone.
Thank you, Ms. Arya and Dr. Manasi, and those who attend the English session. Tomorrow we will have a session from our honorary physician of president, that is Dr. K. Nanda, and we'll be talking about a big subject also, that is about some tumors, and let me Dr. L.K. Nanda. So we'll be talking about evidence-based cure of pre-malignant and space occupation tumors. Thank you all. Good night.